Don't ignore it, because it's not just your penis. It's the first thing that wakes up in the morning, and the first thing to go silent when your health begins to decline. I'm not exaggerating. Your penis is one of the clearest indicators of a man's overall health. And yet, ironically, it's also one of the first things we choose to ignore. When it starts acting up, most men think, must be age. Maybe I'm just tired. It'll fix itself. And then they leave it alone, day after day, until the silence becomes permanent. But let's be honest, if your car refused to start every morning, would you just ignore it and hope it repairs itself? Here's the truth. When your penis stops functioning the way it used to, it's not just about sex. It's a warning. About poor blood flow. About dropping hormone levels. About chronic stress weighing down your nervous system. And possibly, even, about your heart trying to cry for help. One major 7-year study revealed, among men with early erectile dysfunction, 14 out of every 100 had a heart attack within 7 years. That's not a coincidence. The blood vessels in the penis are tiny, and that's why they're the first to show signs of trouble when circulation goes downhill. That's why I often say, your penis is your body's early warning system. So don't wait until it goes completely silent. Don't wait until the feeling is gone, and you're scrambling for a fix. The more you ignore it, the quieter it becomes. And when you finally need it most, it may no longer answer. Pay attention. Be present. And if something doesn't feel right, don't hide it. Don't downplay it. See it as your chance to check in on the rest of your body. Because if there's still time, then there's still hope. Never DIY your penis. This is not a test lab. I've seen some of the worst injuries, simply because a man thought he could fix himself at home, out of embarrassment, out of fear, or simply out of desperation. Too many men choose to self-treat their penis problems with hacks found on the internet. Let me be clear. Your penis is not a place to experiment. I've seen things that would sound made up if I hadn't seen them with my own eyes. One man, middle-aged, found a YouTube video claiming that apple cider vinegar would boost size and stamina. He started applying it daily. What did he end up with? Burns, swelling, and a painful infection that took weeks of antibiotics to heal. Another man, much younger, tried something called jelqing. If you've never heard of it, it's a technique where you manually stretch the penis with the hope of increasing its length over time. The result? Permanent erectile dysfunction, because the spongy erectile tissue inside the penis, called the corpus cavernosum, was repeatedly damaged. You can't train your penis like a bicep. It's not a muscle. It's a vascular organ. And when it scars, it doesn't bounce back. The worst case I ever encountered? A man decided to make his own penis ring by cutting a loop out of a plastic soda bottle. He slipped it on to trap blood flow, but then he blacked out. By the time he made it to the ER, his penis was swollen, purple, and cold. And yes, firefighters had to bring in an electric saw to remove the ring in the emergency room. That's not a horror story. That's a true one. I'm not telling you this to scare you, but to wake you up. I know what it feels like to slowly lose confidence in your manhood. I've seen men try anything. Garlic rubs, toothpaste, herbal oils, vacuum tubes, rubber bands, homemade devices. But let me say this clearly. If there was a cream, a stretch, or a household object that could safely make your penis longer or stronger, urologists would have prescribed it decades ago. What makes a penis function well has nothing to do with tricks. It has everything to do with healthy blood flow, balanced hormones, a calm nervous system, a consistent lifestyle. No cream can replace that. And more importantly, no tip on the internet is worth risking permanent damage. Silence destroys erections more quietly than any disease ever could. So please, don't treat your penis like a home project. It doesn't need a wrench. It needs medical wisdom. and compassionate care. Something feels wrong? Don't look for hacks. Look for someone who understands this part of you better than anyone else. Clean it with care, not like a truck windshield. You can scrub dirt off your boots, but don't apply that same logic to the most sensitive part of your body. I once asked a patient, "When was the last time you pulled your foreskin back to clean underneath?" He looked down, gave a shy laugh, and said, "Honestly, I don't think I ever have." That's when I realized something. We need to talk more openly about basic hygiene, especially down there. If you still have your foreskin, you should gently pull it back every single day. Rinse underneath with warm water and mild soap, then dry it thoroughly. Don't leave moisture trapped. Don't let smegma build up, because that whitish gunk you see, it's not just harmless residue. It's a mix of dead skin cells, oil, and bacteria. And over time it can lead to infections, redness, itching, and odor, even temporary loss of sensation. Your penis doesn't need cologne. It needs your quiet attention. Some men go too far, using strong antibacterial soaps, fragrant body wash, even hand sanitizers. I've seen the consequences: redness, peeling, rashes that sting with every touch or drop of urine. The skin of your penis, especially the glands, is more delicate than the skin around your eyes. So if you wouldn't use a product on your eyelids, don't use it here either. Another common mistake: scrubbing too hard. Some guys use washcloths, rough sponges, treating the area like it's a dirty sink. But here's the danger. Too much friction equals micro tears equals entry points for bacteria. And when that skin breaks down, even peeing can become painful. It's avoidable and unnecessary. Now, if you can't pull your foreskin back at all, that's more than just a hygiene issue. That could mean phimosis, a condition where the foreskin is too tight to retract. And if you can't see underneath, you can't clean it. And worse, you can't inspect it. I've seen older men come in with late-stage infections, even early cancers, all because they never checked beneath their foreskin. If you can't see the most sensitive part of yourself, you can't protect it. So here's what I recommend. Use warm water. Choose a mild, unscented soap. Gently pull the foreskin back. Wash, rinse, and dry. Skip the scrubbing. Make inspection part of your weekly routine. You've probably cared for your car with obsessive detail. Listen for strange noises. Worried over every scratch. Your penis deserves at least that level of attention. Not because of vanity, but because it's a part of your health. Clean doesn't mean harsh. Hygiene doesn't mean aggression. And caring should never feel shameful. Don't ignore pain, bleeding, or anything that feels off. Pain in your penis is never random. It's your body's emergency language. And if you don't listen in time, you could lose more than you think. I've lost count of how many men have come to me, too late, when a small discomfort has become an open sore, when a spot of blood has turned into full-blown bleeding, when urination hurts every time, but they still hesitate to speak up. I get it. It's hard to talk about what's happening down there. But here's the truth. Shame keeps men quiet. Silence lets disease grow unchecked. Pain in the genital area, even just a dull ache, can be a sign of a urinary tract infection, prostatitis, balanitis, inflammation of the glands, or a simple yeast or bacterial infection. But it can also be the first sign of kidney stones, bladder stones, or worse, cancer of the bladder or penis. I once saw a man in his late 60s. He'd been noticing a little blood in his urine for over 2 months. He thought, maybe I overexerted myself. Then it started to burn when he urinated. Still he waited. Only when the bleeding worsened, turning darker with a strong odor, did he finally come in. The diagnosis? Stage 3 bladder cancer. If he'd come earlier, it could have been treated with much less pain, much less risk. Most men don't die from disease. They die from waiting too long to check it out. Another warning sign often ignored? Sores on the penis. They're not always cancerous. But you won't know for sure without a medical exam. Persistent ulcers could be a viral infection like herpes or HPV, irritation from friction or allergies, or in rare cases a sign of penile skin cancer. Penile cancer is rare, but when it advances, treatment becomes physically and emotionally devastating. I've seen men forced to undergo full removal of the penis, simply because they waited too long. Not because they didn't care, but because they were too ashamed to ask for help. One of the most dangerous signs is this: blood in your urine. Many men shrug it off, probably just dehydration. But in reality, hematuria is one of the earliest red flags for urinary tract cancers. It might be a stone. It might be an infection. But it might also be something far worse. Don't guess. Don't delay. When you see blood, your body is screaming. So here's what I tell every man. If you feel pain, even mild, take note. If you notice a sore, strange smell or discharge, watch closely for a few days. If it doesn't improve in 3 to 5 days, see a doctor. And if there's blood in your urine, don't wait a single day. One brave step today could save everything you love tomorrow. You don't need to be silent to be strong. Real strength is speaking up when your body is asking for help. Safe and controlled, the mark of a real man. True intimacy isn't about speed or intensity. It's about being calm enough to stay present in every moment. After 60, sex isn't just instinct anymore. It becomes an art. An art of awareness, pacing, and mutual care. And in that art, safety and control are what allow you to feel deeply, without putting your health at risk. Some think, sex is natural, why worry about accidents? But in my exam room I've seen the reality. One wrong angle. One uncontrolled movement. And yes, the penis can actually fracture. This isn't a joke. It's a medical emergency. During an erection, your penis is filled with blood inside 2 sponge-like chambers, the corpora cavernosa. If, during intercourse, you slip out and strike your partner's pelvic bone, or if the penis bends too sharply, the outer sheath called the tunica albuginea can tear. What happens then? You might hear a sudden pop. You'll feel sharp pain. Your penis will swell and turn dark purple. And you'll lose the ability to get or maintain an erection. A penile fracture won't kill you, but ignoring it could kill your ability to be a man. In cases like this, surgery is necessary. If left untreated, scar tissue will form at the site of the tear, causing painful erections, deformity, and long-term erectile dysfunction. That's why staying alert during sex isn't being uptight. It's being wise. So how do you stay safe without losing the spark? Simple. Stay in control, and use lubricant. A small amount of lube can reduce friction, prevent skin tears or irritation, protect the foreskin, make movements smoother and more pleasurable, for both of you. I once spoke with a 71-year-old man who told me, I used to think lube was just for women. Now I see, it saves me every time we're intimate. And he was right. After menopause, many women naturally produce less lubrication. Some medications also reduce moisture. And even for younger women, dryness isn't always about desire. The truth is, dryness is the silent enemy of the aging penis. Lube isn't a sign of weakness. It's an act of care. It means you're thinking not just about performance, but about comfort, safety, and connection. There's also the emotional safety to consider. When you know you're protected from infections, from painful accidents, from losing control, you can relax. And when you relax, you feel more. And what you feel becomes deeper. Safety isn't a limit, it's the foundation. Control isn't restriction, it's confidence. You deserve a fulfilling sex life no matter your age. But fulfillment doesn't come from pushing harder or proving something. It comes from slowing down, from choosing gentleness over force, awareness over assumption, and from treating your body and your partners with the respect they deserve. Don't overheat. Too much heat can silently destroy your manhood. One lifetime of wearing comfortable pants. And yet many men damage their fertility simply by keeping their phone in the front pocket. Might sound small, but for the testicles, temperature means everything. Your body was designed smartly. Unlike women's ovaries, your testicles don't sit deep inside the body. They hang lower, outside, in the scrotum. And that's for one critical reason. They need to stay cooler. The ideal temperature for producing healthy sperm is about 1 to 2 degrees Celsius lower than your body's core temperature. When that temperature rises by just a few degrees, what you lose isn't just sperm count, you lose function over time. So what's heating things up down there? Not ovens, not summer heat, but long soaks in hot tubs or jacuzzis, sitting with a laptop directly on your lap, keeping your phone in your front pocket all day, wearing tight, non-breathable underwear, sitting too long without movement. I once saw a 65-year-old man with severely low testosterone, despite being otherwise healthy. Every morning after his walk, he would sit in a hot tub for 30 minutes. A massage for my soul, he said. Maybe for the soul, but not for the testicles. When he stopped that habit and made a few lifestyle tweaks, his testosterone levels noticeably improved in just 2 months. You can sweat in the gym, but your testicles shouldn't be sweating in silence every day. And it's not just about fertility. Chronic heat in the groin area can also affect hormone levels, especially testosterone, blood flow to the pelvic region, inflammation risks, like epididymitis or prostatitis. Worst of all, it may gradually impair erectile function by damaging the blood vessels that serve the penis. So what can you do? Here's what to avoid. Don't put your laptop directly on your lap. Use a cooling pad or tray. Don't sit still for hours. Stand or move every 30 minutes. Avoid hot tubs longer than 10 minutes, no more than 1 to 2 times a week. Skip saunas and steam rooms if you're dealing with low testosterone or erection issues. Keep your phone out of your front pocket. Try your shirt pocket or a small bag instead. And just as important, wear the right underwear. Choose breathable cotton. Avoid overly tight fits. And when possible, go without at night, to allow the testicles to naturally cool down. You don't need to go to extremes. Just pay closer attention to the little things. Male vitality doesn't just live in your hormones. It lives in every degree of heat you ignore. One laptop, one long soak, one tight pair of pants. They're not worth the slow, quiet damage that you may not realize until it's too late. Be gentle when you masturbate. It's self-care, not a race. What causes you to feel nothing in the bedroom might not be your age, but the way you've been touching yourself for years. Most men never talk about how they masturbate, and because they don't talk about it, they don't realize that how they do it could be the reason they've lost sensitivity. I once asked a patient, "Do you use lube when you masturbate?" He said, "No, I just get it over with. It's a private thing." And that is exactly the problem. Masturbation in itself is perfectly normal. It doesn't make you weak. It doesn't drain your manhood. In fact, when done properly, it helps maintain erection reflexes, relieve stress, and keep penile tissue healthy. But the issue lies in the method, especially the intensity. One of the most common mistakes I see is the death grip, a term used for masturbating with excessive pressure and speed, usually done in a rushed, tense manner, as if you're trying to finish before someone walks in. Here's the problem. Your penis doesn't experience that kind of stimulation during actual sex. No partner can replicate the tightness or pressure of your own grip. And over time, your body starts to learn that only this one specific kind of touch is pleasurable. Eventually, this leads to loss of sensitivity during real intimacy, difficulty reaching climax, weak or absent erections, or only being able to finish through the same intense solo routine. The more forcefully you train your body to respond, the less it responds to what's natural. You're not broken. You just need to retrain your response. And yes, it's absolutely doable. Here's how to bring things back into balance. Choose the right time and space. Don't rush. Don't treat it like a secret chore. Make it an act of care, of being present with yourself. Always use lubrication. Your penis isn't designed for dry friction. Using lube not only protects the skin, it also helps you rediscover the subtle sensations you've been missing. Adjust your technique. Try a lighter touch. Focus on feeling, not just on the goal of climax. Change positions. Mimic movements that feel more like partner intimacy. Moderate the frequency. You don't need to do it daily. But don't go weeks without and then rush back into old habits. Moderation is key. Sometimes I hear men say, "If I'm still masturbating, does that mean I'm not a real man?" Absolutely not. Masturbating means you still have desire. Changing how you do it means you're smart. And choosing to be gentle means you want your body to keep working, naturally, for years to come. Most men don't lose their sex life because of aging. They lose it through silence, and through years of getting it wrong without knowing. You deserve to feel. You deserve to enjoy. Without shame, without pressure, and without forcing anything. Just treat yourself with the same gentleness you'd offer someone you love. Don't smoke. Your overall health defines your manhood. You don't lose your manhood because of age. You lose it because of small daily habits quietly stealing it away. I've never met a lifelong smoker who still had perfect erectile function. That's not a guess. That's science. That's years of data. And hundreds of stories told in quiet exam rooms. Smoking, whether traditional cigarettes or e-cigarettes, directly affects the blood vessels in your pelvis. Every puff causes blood vessels to constrict. It reduces blood flow to the penis. Over time, those vessels lose their flexibility. And with them, goes your ability to get and maintain an erection. You might think, it can't be that serious. But the truth is, a cigarette is smaller than your finger, but it can block the blood supply to your manhood entirely. And that's not all. Smoking also dramatically increases the risk of bladder cancer. A silent, deadly disease common in older men. It rarely hurts in the beginning. It often starts with a whisper, a bit of blood in your urine. I've treated men who had only that one symptom, a faint pink trail in the toilet. They thought it was nothing, a hot day, or just overexertion. By the time they came in, it was stage 2 or 3. And most of them were smokers. I understand. Quitting smoking isn't easy. It's a routine, a comfort, a ritual. But I always ask, would you trade 5 minutes of comfort for 10 more years of health with someone you love? And it's not just smoking. There's something bigger at play. Your lifestyle. You can't expect your manhood to thrive if your whole body is suffering from high cholesterol, unstable blood sugar, chronic sleep problems, constant stress, or a sedentary life with no movement. A healthy lifestyle doesn't have to be overwhelming. Start small. Eat cleaner. Cut back on sugar, salt, and processed foods. Move your body. Just 30 minutes a day makes a difference. Sleep 7 to 8 hours every night. Manage stress. Walk, meditate, talk to someone. Stay hydrated. Watch your weight. I'm not asking you to live like an athlete. I'm asking you to live like a man who still wants to feel like a man in every way that matters. There's no pill more powerful than a good lifestyle, and no Viagra stronger than a truly healthy body. When you take care of your heart, your penis thanks you. When you get enough sleep, testosterone rises. When you relax, your blood flows better, and your relationship becomes more connected, more satisfying. You don't have to change everything today. Just start with one thing. One small, consistent habit. That's all it takes to protect the version of yourself you still want to be. Don't be too hard on yourself. One off night isn't the end. It's not the effort to stay strong that drains you. It's the pressure to be perfect that quietly shuts you down. There's a kind of silence I've seen in many men, especially after the age of 60. They don't talk. They don't ask. They just sit quietly, eyes down, and exhale slowly. And when I ask, they say one thing: I'm not the man I used to be. I understand that feeling. The first time you can't get an erection when you want to. The first time you feel like you've disappointed your partner. The first time your body doesn't respond like it used to. But please remember, one bad night doesn't mean it's over. It just means your body is asking for a little more attention. The real issue isn't that something didn't work. It's how you treat yourself afterward. You start to worry. You overthink. You fear it'll happen again. Then you pressure yourself to perform, to stay hard, to prove yourself. And that pressure? It becomes the very thing that makes your erections worse. Many men fall into what we call the anxiety cycle. One failure, anxiety to anxiety, leads to performance issues, more failure, more fear. It repeats itself until some men stop trying altogether. I've seen men emotionally withdraw from their relationships, not because they don't care, but because they're ashamed, because they feel broken. But you don't have to carry that weight alone. The first step is not medication. It's forgiveness for yourself. And the second? Talk to someone. Your partner. A trusted friend. A doctor who listens and doesn't judge. The more you hide your fears, the bigger they grow. The moment you speak them out loud, they begin to shrink. I once saw a couple in their 70s. The husband hadn't touched his wife in 6 months because he felt ashamed, like he wasn't a real man anymore. When they came to see me together, I asked her, "Do you feel hurt by this?" She smiled gently and said, "I don't need him to be who he was 30 years ago. I just want him to still want to hold me." They both cried. Because the truth is, intimacy isn't just sex. It's connection. It's emotion. It's trust in physical form. And when you stop punishing yourself, your body starts to relax. Erections don't come from tension. They come from safety. Safety comes from the belief, I'm still me even if things aren't perfect. Manhood isn't about never falling. It's about knowing how to rise again. And not doing it alone. You deserve grace. You deserve patience, especially from yourself. And when you can give yourself that, the rest starts to heal. Use it or lose it, the natural rule you shouldn't ignore. Your body is always trying to protect your manhood. But if you stop using it for too long, it will assume you don't need it anymore. It might sound strange, but your penis has its own kind of memory. Not emotional memory, but biological memory. It remembers rhythms, blood flow, tension, and unfortunately, neglect. A healthy man typically has 3 to 5 erections each night, even without sexual stimulation. This isn't random. It's a built-in reflex known as nocturnal penile tumescence. And it matters, because each of those nighttime erections brings oxygen-rich blood to the erectile tissue, keeping it elastic and alive. Those nighttime erections aren't for pleasure. They're your body's quiet way of preserving what makes you a man. But when those erections stop happening, whether due to stress, hormonal decline, health issues, or prolonged lack of desire, your internal tissue starts to change. The smooth, sponge-like structures lose flexibility. Scar tissue may slowly form. Blood vessels shrink or harden. And what you'll begin to notice is, erections take longer. Your penis may appear shorter. Sensation fades. Or erections aren't strong enough for intercourse. Some men say, "I just don't feel desire anymore." Must be age. Not entirely. It's part of a downward cycle. Less desired, fewer erections, no nighttime tumescence, weak blood flow, even less desire. And when you leave it alone too long, your body simply unlearns how to respond. Stops trying. Now, I'm not saying you need to have sex all the time, but I am saying you need to maintain the natural mechanism in whatever way makes sense for your life. If you don't have a partner, gentle, mindful self-stimulation is a healthy way to maintain function. If you're recovering from illness, Even occasional light erections help keep tissue oxygenated and flexible. You've probably heard the phrase, use it or lose it. When it comes to male sexuality, that's not just a saying. It's a biological truth. Stop using it, your body drops the reflex. Stop getting erections, tissue begins to decay. Stop thinking about sex, testosterone slows. And over time, your identity as a man starts to fade quietly, invisibly. Your penis doesn't ask for much. Just that you don't forget it exists. You don't need to run a marathon. Just make sure blood still finds its way there every now and then. Because one day when you want to use it again, you'll be glad it still remembers how. Men don't grow old because of age. They grow old the moment they stop caring for themselves. If you learned something new today, leave a comment below. If this video helped you, share it with another man who might need it too. And if you want to keep receiving honest, science-backed information like this, make sure to subscribe and turn on notifications. Because men's health deserves to be talked about. With care, with clarity, and with dignity.